Hello, my name is Cynthia Anaba,
And my name is Percy Brown.
and today we'll be talking to you about the cultural aspects of mental health in Ghana. For the past decades, non-biomedical form of treatment has been very prevalent in Africa, and Ghana is not left behind. So Ghana is known for deep superstitious and religious beliefs. Thus, mental illness is sometimes associated to witchcraft or curses for one's wrongdoing. This is no common to find mental health treatments being left to traditional practitioners and faith-based healers, who sometimes um, take these victims through maltreatment, such as isolating them and chaining them, starving them of food and water, and also meting out some form of punishments like flogging to them, with the aim of driving out the evil spirits from the individual. Now, this has caused a lot of stigma around mental health, mental illness, that people are not willing to own up to their mental health conditions because no one wants to risk being marked as being a witch or suffering from a curse for one's wrongdoing. We can also acknowledge that in Ghana, we have just three psychiatric hospitals which are located in the southern parts of the country, known as the developed parts of the country, which is very sad because a country of 23 million people only has three psychiatric hospitals which are located in the southern parts of the country to the neglect of the northern parts of the country. Thus, it is very common to find these people in the northern parts of the country still maintaining traditions and subjecting mental illnesses to treatment forms by traditional healers and faith based practitioners. It is also very sad to note that the three psychiatric hospitals are still maintaining the institutionalized form of mental health care, where these patients have to stay in the hospital for long days and in isolated wards without far from their communities and their families, which is very poor in this day and age, where community based interventions have been known to be a very good source of mental health treatment for people in the community. Also, the binary stage model of diagnosis of mental illness have left most Ghanaians to forget about mental health conditions like depression, anxiety, post traumatic stress, and other forms because mental health illnesses is only associated to the madman on the streets who is running with dirty clothes and seeking for food on the streets to find. This is very sad because mental health illnesses encompass a range of disorders and which is not only limited to schizophrenia or psychotic disorders, but it is very sad that Ghanaians only see mental illness when one is running on the street and has lost his cognitive and behavioral abilities.
Still on the binary form of approach in diagnosing mental health care, it tells us that a person is either normal or abnormal. This undermines the symptoms that could be in between the time where a person just experiences a mental health illness and the time where it gets very severe. The binary approach helps us to undermine the lived experiences of a person who has mental illness. And it also promotes marginalization such that people who are considered normal feel as if they do not have any form of symptoms of mental health, whereas the form of approach is wrong in diagnosing the mental health care because there may be individuals who have started developing symptoms but are not qualified to be classified abnormal, hence may feel that their mental health is sufficient enough and may not be encouraged to seek medical care. The Mental Health Act in 2012 is a step in the right direction to progressively shift from institution-based care to community-based care. That is the integration of mental health care in primary health care. This has helped us to now extend the mental health care to involve all other stakeholders that can contribute to ensuring effective mental health care. Nothing about us without us. The mental health care now involves friends and families of the patients. It involves vocational training centers, educational and recreational facilities that can all contribute to ensure that the mental health experience of a person is catered for. This form constitutes the hybrid approach that will help us to outline the experience of a person as a continuous dimension, that there may be stages where the person could require the help of medical professionals, as well as there may be instances in the experience of the person that will require rehabilitation and care outside the confines of a hospital. There has been increase in the number of sensitization campaigns on mental health recently in Ghana. There have been more establishments of NGOs that have created more awareness on mental health, the prevention and the forms of treatment available in Ghana. An example is the on the Move EV NGO, which has its core project based in K2000 Volta region, which seeks to bridge the gap between the collaboration of faith and traditional leaders, as well as medical health professionals. Currently, about 7% of our GDP is lost due to persons suffering from any form of psychological disorder, as compared to even just 4% of our GDP lost due to malaria. Hence, there is a direct correlation between the mental health of a country and its economic growth. The more mentally healthier communities are in the country, the more positive economic growth can be achieved. It's very important because with mentally healthier communities who have benefited from effective mental health care services, even persons who are still suffering from mental disorders can be able to still contribute in the workplaces and the communities, and also make significant contributions to the development of their communities and the countries at large. Therefore, there is the need for us to continue to do more, as we cannot get enough of more awareness and more forms of prevention of mental health care. Currently, there is a low budget of mental health care in Ghana, and so the mental health sector is usually neglected in terms of building of more medical hospitals for mental health care, training and retraining medical professionals, among others. Hence, there is the need for us to effectively allocate funds into the mental health sector to be able to equip our professionals and institutions to be able to handle severe mental disorders. Mental health is important for a country, and Ghana, we believe that the mental health of our citizens will have an effect on the economic growth of our country.
And also, lastly, we believe that moving forward as a nation with healthy and vibrant citizens who are mentally sound and stable, the role of traditional leaders and faith based healers should not be left behind. That is why the Act makes provisions for orthodox and non orthodox treatment for mental health care in Ghana. And so we hope for future alliances with these medical practitioners and traditional practitioners so that the mental health system in Ghana can reach a goal of covering up the treatment gap in the population of Ghana. Lastly, there is no health without mental health. And thank you very much.